So I'm Allison Agwu, and I am a physician. I'm an associate professor, actually, at the Johns Hopkins School of Medicine, a director of the Pediatric Adolescent HIV AIDS program here. I also direct the Young Adult Access Care Early Clinic. So it's a clinic that helps to transition young people to adult care. And I also oversee a lot of the clinical research for adolescents, young adults, and young women and with living with HIV or trying to prevent HIV acquisition. In all of those hats, definitely I lead a team of not just providers, but social workers, case managers, etc., outreach specialists, with the whole goal of trying to make sure that we help young people live their best with HIV. So not just providing their medications, but sort of 360-degree care for them and supporting them in their lives, again, medical and beyond. Yeah, so, mentorship is an interesting word. I think mentorship is, because you can have multi-level mentorship, right? So you can have mentorship top-down, where someone is above you and they're mentoring you and you're sort of below them looking up. So in that way you're guiding and helping to navigate. But you can also have same level mentorship where someone is just your colleague and partner or friend that you're helping. And then you have mentorship from those below, quote unquote, you, where they're teaching you and making you better at what you do. So I think mentorship is all around, but if you had to use one common theme, it is a guide and assistant in helping you become something on your journey towards something. So I think it's critical to have mentorship when you do that for these young people, because they're not just navigating their transition to adult care, but with the age that they're transitioning in life in multiple ways, right? So having to take the baton from supporting themselves, their households, some of them have kids, so there are multiple things that are involved. And so I think it is so important to have somebody to be almost a sounding board, but also a guide to provide some ways to say, well, this may be a way you might want to do it, to provide resources, and sometimes just to smack you and say you're not doing it right? But it's critically important, because with all those balls that young people are oftentimes juggling, it's easy to just say, you know what, let's let one of them drop, and oftentimes it can be their medical care, or depends on what's going on. So it's critically important to have that. I'm going to take a line I heard from Will Smith this week on Red Table Talk. So, but he said, one, you got to listen. I think a lot of times we think that we have the answers and we're passing information, but you got to listen to hear what people have to say, young people, what their needs are, what are the things that are most important. You have to give them feedback on things that they may not like, and be willing to listen to hear what they have to say. And then make your darndest best effort to understand. I think part of the problem with transitioning to adulthood, etc., is that we've all been there. We may not have all had HIV, or we may not all had X, Y, and Z, but we've all gotten to be an adult and said, this is the way I did it, so this is the way you should do it, and here are these things in place. But you have to actually be willing to put yourself in someone else's shoes to understand what they are navigating for you to be effective at guiding them or helping them get where they need to be. And then the last is validate. So if they tell you, this part of your process doesn't work, or this, whatever, instead of defending, validate. I'm sorry that happened. Let's talk through that and tweak through that, and then find a way forward. So I think if those are the tips, those would be the three things. So listen, understand, validate, and then together, I'll give you a fourth one. It's got to be a partnership, because I can't be guiding over here and think I'm doing whatever without partnering with the young person for what works for them or what doesn't.